Hi, it's Dr. Lori Baudino. I'm doing a collaborative check-in with Dr. Song with Healthy Kids and Happy Kids. Dr. Song, I have been such a fan, as well as just like an avid collaborative thinker with you during the past couple of years. I can't tell you how often families bring up your name when I'm meeting with them, or that they're sharing resources that what you've shared, and just you've just been such an incredible source of information and just a sense of relief of looking at the whole child. And those of you watching know that I believe, as a psychologist, in looking at the whole child from the bottom up, how movement in the body affect our emotional system, as well as all the areas of health. So I think it is such an honor to have you here today and get to talk today. So
Oh,
thank you for being here.
thank you so much for having me. I'm excited to do this.
Of course. Yeah. So I know I mentioned your title, right? Happy Kids and Healthy Kids. Tell us a little bit more about what you are doing in your practice.
Yeah, I'm an integrated pediatrician and pediatric functional medicine expert, and I have a brick and mortar practice in the Bay Area of San Francisco called Whole Family Wellness. And my practice has just been, I guess silver linings of the pandemic. It's been burgeoning, but I just couldn't see enough patients in the office to fill the need. Functional medicine, I can really get to some of the root causes, the underlying core clinical imbalances that might underlie your child's behaviors or
Mhm.
attention and focus problems or anxiety or autoimmune illnesses, eczema, asthma, you name it. And so there came a point where I just thought I can no longer in good conscience say no to seeing patients in the office because I simply don't have the time. How can I bring this information out to parents who really need this information, who really need to understand the gut brain connection, the gut immune system connection,
Mhm.
the whole child wellness approach? And so I started Healthy Kids, Happy Kids as an online resource for parents and practitioners. This is now back in 2016,
Yeah.
and it's been a passion work, and it's grown now to offer programs for parents. And as you said, I mean, through the pandemic, it's just been
Yes.
such a need for parents to have um, grounded, science-based information that
Mhm.
takes into account some of the nuances that we're seeing and really
Yep.
tries to make individualized decisions when we're confronting a public health crisis. So
Absolutely.
that's been sort of my mission through the pandemic, is to really help parents navigate all of this craziness with a little bit more calm, a little bit more confidence. And even pre-pandemic, that was my mission, right? Those middle of the night
Absolutely.
fevers. Oh my gosh, what do you do, right? Or my kid has eczema. What's the next step? I mean, all of those questions. So I love sharing this work.
Yes, it's so important. And like you said, even before the pandemic, just helping families understand that there are so many avenues we can provide that support for, from that gut support, autoimmune system, nutrition, diet, sleep, as well as the psychological and the education and all the processing. I find it so important. And it doesn't seem like it's something that's always accessible. It's out there, but sometimes it can feel very overwhelming to parents. And also just to know that we don't have to go with one answer. We can actually get it from multiple ways, which to me gets rid of the unknown and that chaos feeling that we can feel as parents, and gets it into the predictability. Like, oh, if I feed my child this, if I get them in this environment, I get them this support, that we can have a whole team approach, a whole approach.
Absolutely,
So
I love
yeah.
that whole team approach. There's never one person or professional or expert out there that has all the answers for your child,
Mhm.
because we're just not that. I mean, we are uh, simple yet complex, and we are unique, right? And how your
Right.
child is responding to their world and their foods and their environment is unique. And so I love having that team approach. I love working with my community psychologists and
Mhm.
occupational therapists and ABA therapists and teachers. It really takes a collaborative approach. Unfortunately,
Absolutely.
not all parents have access to such a collaborative approach.
Absolutely. Right.
And so, this is where getting information out there, like you're doing with these
Mhm.
collaborative check-ins, so parents are aware, hey, parents often know in their gut that there's something missing, right?
Hmm.
That there's
Hmm.
something that they're not accessing to support their child in the fullest way if their kids are having any
Real
health
challenges.
concerns, right?
Yes.
Whether
Yeah.
physical or
Hmm.
psychosocial or emotional.
Hmm.
And so when you have that gut feeling, you just this is such an amazing opportunity that we have in this online space to say,
Hmm.
hey, look, there's some other things we can look at and maybe look for this kind of a practitioner or this
Yeah.
kind of approach for your child.
Yeah, ask these questions. Yeah. So one of the questions I love to explore, because I specialize with looking at the body. So this bottom-up approach of understanding that it's not just how we integrate information in our minds and think about feelings, but how we express them through our body and through movement. I always love, and I think this is on your website too. How do you use movement and your body for your own health and also for your work? How do you advocate for it, or how
Yeah.
does it work for you?
Well, movement is, as we've seen through the pandemic, children and adolescents have had a significant drop in their physical activity on a daily basis.
Mm-hmm.
I've had some friends who they took the pandemic as an opportunity to go on, miles long hikes every day and,
Yep.
move
Yep.
their
That
bodies
was
in a
me.
different way, right?
Yeah.
But not
Yep.
everyone did that. And our
That's
children,
right.
most of our children did not, at least
Mhm.
according to the surveys. And you may know as a parent and just see without the organized team sports or maybe
Mhm.
your
Mhm.
time, really was not as freed up as we had hoped for in the
Right.
beginning.
Yeah.
And so there are so many factors that are going into to play with this epidemic of childhood anxiety and depression
Mhm. Mhm.
that has come to light during the pandemic. It's been there for
Mhm.
decades before, right?
Yes.
We're just
Yeah.
now hopefully shining a brighter light on it and saying, look, we need to really address this. But movement is such a key piece of that. We often think of movement and mindfulness, those two M's that are so critical for overall well-being as sort of the secondary. I'll do it if and when I have time.
Mhm.
And
Mhm.
I really encourage elevating those two as
Mm.
as important as any food you choose to put in your child's
Mm.
body or
I love that.
anything you put on your child's skin or
Mhm.
many of us as parents we're aware, okay, we're going to look at the ingredients on that shampoo label and not choose something with parabens or
Yep.
choose foods that are as organic as possible. And so we want to
Yep.
think about all of these things that also come into play with supporting our child's overall health and well-being, and movement is definitely one of them, especially movement in nature. In fact,
Mm.
there are
Yep.
studies looking at exercise in nature as being
Yep.
just as effective as an SSRI medication for
Mm.
depression and anxiety. There are many different reasons for that, and
Mhm.
we're trying to kind of elucidate what are those mechanisms. One of them is just I mean, when you're in nature, right, all those endorphins, the exercise endorphins, the feel good
Yep.
hormones that get released. But exercise also supports a healthy gut microbiome. I mean, it's so
So
interconnected.
yes,
And in fact, they found, I mean, it's just so fascinating. I could talk about the gut forever,
I
right?
love it. Yeah. Yeah.
But they found, that there are
I'm like, yes,
animal
please teach
studies.
us.
Yeah, so
Yes.
there are animal studies, right? And
Yeah.
human physiology is very similar to rats. As
Yeah.
much as maybe we don't want to admit that, yes, we can learn a lot from these animal studies. And so
Yeah.
fecal transplants, where you transplant poop from one animal to another, and even human, fecal transplant, have such amazing potential as we think about the future of health and
Mm.
what the gut microbiome means for our brains and our bodies. And so they took this one study looked at the fecal microbiome of
Mhm.
rats that were exercised and healthy, all those good metabolic markers on blood tests,
Okay.
transferred that fecal microbiome into unhealthy, obese rats that weren't exercising, and their physiologic markers of
Huh.
metabolic health improved even without an increase in exercise, right? The gut is
Wow.
that important. I mean, even they took
Mm.
another similar study looking at rats with depression, depressed behaviors,
Mhm.
and
Mhm.
transplanted the gut microbiome of those rats into healthy rats, and those healthy rats took on a depressive behavior as well. So it's so important, and so movement has all of these pieces in it, right? We have all of these
Absolutely.
amazing feel good pieces, and I think it does come back to a lot of it, the gut microbiome and our healthy behaviors. When we choose to prioritize movement and mindfulness, we are choosing to make decisions that foster healthy lifestyle. And that's
Yeah.
so important. I mean, through the pandemic, even before the pandemic. I mean, I'm going to go back to 2005. This is now nearly 20 years
Mhm.
ago. The New England Journal of Medicine published a study that projected that for the first time in history ever, our children are expected to have shorter lifespans than
Mm.
us, their parents. This is with all of our, modern medical advances,
Of
right?
course. Yeah.
And almost all of it is due to lifestyle related
Right.
diseases.
Yeah.
And
Yeah.
now fast forward, 20 years into the, in the pandemic, 2.5 years into the pandemic, what do we know is really the biggest risk factor for serious disease, even of
Mhm.
dying in children and adults, apart from elderly age. It's lifestyle related diseases.
Right. Right.
So obesity, diabetes,
Mhm.
overweight. And so this is where, again, we need to think about, medicine in all of these different ways,
Yes.
movement as
Yep.
medicine, mindfulness as medicine, food as
Mhm.
medicine. And then there's the medicines, right? but,
Absolutely.
but the
Absolutely.
medicines should be down here.
Right, right. And in order for those medicines to work, we want that gut and the body to be functioning at its optimum so that it can receive it
100%.
because
Yeah.
otherwise it doesn't work. Yeah, and I love your connection of mindfulness and movement. To me, I'm such an advocate for saying that mindfulness doesn't have to be sitting still because
Mhm.
there can be this misconception of like meditation or mindfulness teaching your children to be still, getting children to sit and like hold their bodies together. And to me, it's about honoring that they can actually move and we can experience this awakened awareness in everything we do.
Everything.
In the pandemic, I've been talking about it in terms of like that temperature check. We've been now become this whole society of taking temperatures, getting a baseline of our children. But to me, it's also about taking the temperature of what's that baseline of how your child moves. How do
Yeah.
they express themselves in their bodies? How are they connecting the gut and the brain, getting that baseline of temperature like through the whole body, not
Yeah.
just like temperature, how hot are we, how cold
Yeah.
are we.
I mean, we've even found that there are certain genetic SNPs, these genetic
Mm.
single
Mm.
nucleotide polymorphisms or variants that can show that for certain individuals, children and adults,
Mm.
exercise is therapeutic. It is
Mm.
what is needed for
Mhm.
those children who maybe have a diagnosis with ADHD or a diagnosis with anxiety or
Absolutely.
depression, that is a key piece. I mean, exercise is important for everybody, but in
Absolutely.
particular, there and parents know, right? Their parents know,
Right.
okay, this child of mine, if I don't run them around the block, like
Right.
50
Right.
times, it's
Right.
not going to be the best evening. Whereas the other
Absolutely.
child might be perfectly content and
Sure.
peaceful with reading a book indoors, right? So we have
Right.
to know our children, but this is
Absolutely.
we're finding these underlying pieces, and oftentimes for children, especially as they get older, right? Think about your teenagers, for parents
Yeah.
who are listening, where
Yeah.
it can feel like pulling teeth to get out
Get them out of
any
their rooms.
information,
Yep.
right?
Yep. Yep.
And just also know like what's going on in your day, right? How was school? Okay, right?
Hmm.
What's going on with your friends? Nothing, right? And
Right.
so when you can walk with your team,
Absolutely.
right, and
Yes.
move,
Just talking
oftentimes
about
there's
that.
so many things that will come
Mhm.
out
Right.
that can help you and your team and your younger kids connect on a level that they wouldn't necessarily open up to and express if you're sitting there face to face and just grilling them with questions, right?
Absolutely, absolutely. Yeah, some of my favorite kind of stories of adolescence are how much they communicate that nonverbal, whether they're like ripping apart their shirt as they're talking and the parent saying like my child's not talking to me. I'm like, they look like they're saying a lot. So really understanding that body and connecting to children after school, and we'll talk about school for a second. But after school, those questions of like how was your day? When we join our child just in our bodies and kind of move with them or sit next to them, kind of mirror their bodies, all of a sudden we get more of that connection.
Yeah.
Really tap into that. As we're going into the school year, any hot topics or kind of themes that you're hoping parents are thinking about or supporting it within your practice right now?
Yeah, well, this is a unique back to
Mhm.
school time
Yeah,
where, we are now 2.5 years into the pandemic.
yeah.
And we're in a very different place than when we were back in February, March of 2020, when things initially went into lockdown. But with that, there's even more uncertainty as to how do we approach going
Mhm.
back to school for our children. Whatever we think about masking or not masking, most schools are not going to be masked, right? Or at least they're going to be mask optional. life is going to be a little bit more quote normal, except we still have COVID around. And we
Yes.
have colds and flus and strep throats and, stomach
All that.
flus and
Yep.
norovirus and all the fun things that come along with going back to school. So
Right.
it's really important to think about, how do we support our children's immune system? How do we
Mm.
support their immune resilience, especially? And
I love
I
that.
really want to emphasize the word resilience, because going back to school, supporting your children's immune system and immune resilience does not mean never getting sick. And in
Mm.
fact, these past 2.5 years, where I've had some parents say, "Oh my gosh, these 2 years have been amazing. My kids didn't get sick at all. Not a single cold."
Yeah. Yeah.
Well, we're
I can
finding
relate
that
to that. Yes.
yeah,
Yes.
but we're finding that,
Mm.
for some children, that means that their immune system has lost a little bit of their muscle strength, right? A little bit of their
Interesting.
training.
Yeah.
And
That makes
so
sense.
we need to kind of retrain and get used to that, because every time we get sick and recover, just like, I mean, think about every time, your child has a stressor and recovers on the other side, they build
Build
skills
that.
to
Yeah.
get
Absolutely.
stronger for the next time around, right? Because there's
Yes.
always a next time around. There's
Yeah.
always the next time they're going to be exposed to a cold bug, or the next time there's going to be something that stresses them out. And so we
Absolutely.
want to build that resilience in our children's immune system, just like we think about building a
Mm.
resilient mindset in our children. And so with that comes, first of all, staying calm, right? Not being
Yes.
panicked
Yes.
about
Yeah.
starting into the school. We know now, of course, there are children who are going to get seriously sick, with COVID, but we know that that's a very small proportion of children,
Mm.
right?
Mm.
And I mean, my son was hospitalized with COVID way back in March
Yes.
of
Yeah.
2020,
I
right?
read
But
about
that was
that. Yes.
before we knew anything about COVID, and the fear was like this
Yeah.
heavy weight that was over all of us. So we know more. We can enter this with healthy respect for what's going on, but also not fear and panic, right? Really, there's a
Absolutely.
difference. And so, because we also want to impart to our children, okay, you got this, your immune system is what it's meant to do,
Yeah,
right?
yeah. I mean, even
Um,
you just saying that gives me comfort. If those of you listening, like that idea of seeing that resilience as, okay, my body's building strength. When I make a mistake, I learn the neural connections get stronger. That's what we think about in psychology. And you're kind of giving us permission to also know that like our bodies can build that, which is really,
we
really
can. And
helpful.
that's, yeah.
Yeah.
And how do we build that, right? I mean,
Yeah, yeah,
before we start talking about, there are some
yeah.
supplements that I think are really important, especially for children who may not be the most varied, wide-ranging eaters, right?
Leaders.
So, but before we get into that, I mean, what are the foundations? I mean, there is the movement piece. We know that mild to moderate exercise, several times a week does strengthen
Movement.
the immune system, protect against colds and flus.
Yeah.
And so there's every reason to believe that that's going to continue to be the case, through the rest of this year and whatever comes next. Sleep is really, really, really important,
My
right?
favorite topic. Yes,
Yep. So
yes, yes.
sleep is so important. Most
Mhm.
adults and children are chronically sleep deprived.
Deprived.
So it
Yeah.
is really now, as we start heading back to school, kind of ratcheting back your bedtime so we get
I
onto a good rhythm,
absolutely agree. Yes.
right?
And I just want to plug out there that there are resources like you, myself, there's many others, knowing that you don't have to just think, oh, my child's a bad sleeper or they don't sleep or our family can't get that routine together. There are so much ways to support that individual child that I really
Yes.
want parents to start asking the questions so that sleep becomes just something so enjoyed and honored and appreciated in your homes.
Yes.
So that's my
And
little plug. Ask for support because we
100%.
can get your child sleeping. We can get
Yes.
you sleeping. So
Yes,
I'm
especially for
full
parents, right?
believer.
So many parents
Absolutely.
also have trouble sleeping. And
Yeah,
so
yeah.
there is
I
so much
love that.
support out there. And so
Mhm,
that's key. Why is that key? Because our brain
mhm,
releases certain compounds that restore our health in our sleep. Sleep is a
mhm.
time for restoration and repair.
Repair it. Yeah.
It's a time for detoxification. If we
Mm,
don't have that, so there's Dr. Robert Navio is an amazing doctor at UCSD, and he describes something called the cell danger response, which is
mm,
our cell's primitive way of managing any stressor, whether it's a physiologic stress, an infectious stress, a
okay.
psychological stress. And so when we tip over into the cell danger response and this healing pattern that has to happen if we're going to overcome that stressor,
Mm,
we get tipped in when that stressor overcomes the ability of the restorative capacity of sleep. So if we
mm,
are sleeping well and we can have that restoration, then we should be able to get over, whatever
mm.
comes our way very, very quickly. Okay, that's why, I mean, that's one of the many, many reasons why it's
Yeah,
important,
absolutely.
right? And then there are, as far as foods go, one of the things that we really want to think about is just cutting back on the refined sugar. I'm not going to say no sugar, and I'm
Right.
not going to, make parents and kids feel so horrible for choosing to have whatever they chose to have, right? I mean,
All
summer
summer.
is a
Yes.
time for indulgence, right? And barbecues and whatnot, but really thinking about and understanding that sugar will reduce your immune system's ability to fight off infections by up to maybe 50% even. And that effect can last for hours and hours. So, trying to make sure that we're keeping that refined sugar down, using
Mhm.
fruits and dessert and looking at labels. I mean,
Yeah.
I was actually personally shocked when I was buying this organic, multi-grain seeded nut bread that I thought, oh, so healthy. And I looked, and one slice of bread had nearly a teaspoon of sugar in it, right? One slice, right? If you've ever
Yeah.
baked, okay, you don't, there,
Yeah, you're gonna eat
that's a
more
lot
than
for
one.
food, right?
Right, right, right,
So
right.
just being mindful of that. And then what foods do we want
Mhm.
to focus on? The foods we want to focus on are the foods that are going to really support immune response. So minerals that are really important. Zinc is really important for immune health.
Mhm.
So where do we get those? We get those in animal proteins and nuts and seeds. Pumpkin seeds are one of my
Mhm.
favorite sources. Shellfish is another really great source. Are some vegetable sources of zinc as well. I have this all written down that I can share with
Yes,
you, right, in a
I
little
love
guide
that.
that
Absolutely.
and so focusing on that, also vitamin D, the most essential nutrient, I think, to
Mhm.
get us through the winter in a healthy way, our brain and our immune system. Not a lot of vitamin D rich foods that are kid friendly. Of course, there's milk, but a lot of milk has to be vitamin D fortified the way it's processed. And
Mhm,
frankly, casein, the protein in milk, is highly inflammatory to many,
mhm,
many kids and adults. So I am not a big advocate of guzzling down gallons of milk. Um,
right.
in moderation, having some cultured dairy in the form of yogurt or cheeses, if your child tolerates, is okay as well. But in our culture, it's very, very dairy heavy and wheat heavy. So we can pull that back a little
Pull
bit
it back.
and focus on other,
Yeah.
having
Mm.
variety, focusing on other food sources of vitamin D. Eggs are going to be a source. Mushrooms are going to be a source. My kids aren't big fans of mushrooms yet, so I'm working on that.
Yeah.
There's fatty fish, salmon, even fish eggs. My kids do like in sushi, they like the fish eggs, so
Mhm.
that's a really great source. Vitamin D is often one that needs to be supplemented though. The vast majority of kids and adults are not in optimal range. So that's one that I would definitely consider supplementing for the winter. And then
Mhm.
colors, right? Those antioxidants. Every color of your fruits and vegetables has a different phytonutrient benefit, a different
Mhm.
antioxidant benefit. And when we think about what antioxidants are, when we get sick or when we get exposed to a stressor, the first thing to know is that psychological stress and physical stress create the same kinds of inflammation. Okay, so
Mhm.
our body doesn't know the difference.
Right.
When we have that stressor, our body creates oxidative stress or
Mm.
free radicals. So what we need then to mop that up quickly are antioxidants. That's why those colorful fruits and vegetables are so important. And that's why it's also important to
Yeah.
get that variety in, right? And so
Yeah.
all of that, if we could start with some simple foundations, and then
Absolutely.
expand. And this might sound overwhelming to some parents. Some parents are like, I got this, I'm done getting in my salad tonight, right? With
Yep.
five different
Yep.
vegetables and fruit. For others, it's a bigger step. And so just take one step at a time, right?
Absolutely.
Look, and I always like to start with the lowest hanging fruit. If for your family, getting in that movement every day is going to be the easiest, and start with that, right?
Right. Right.
If for
Right.
your family, it's going to be adding a piece of fruit at breakfast, then start
Mhm.
with that, right? So
Yep.
just one step at a time.
Absolutely. Here's some other moments here too of like, easing back on your calendar for sleep,
Yes.
or I love the idea of even, I think children will grasp, I know they will grasp the idea that each vegetable's color has different antioxidants. How exciting is that? There's a reason for the colors. Really thinking about how this can be so playful for your children, and that as soon as they're understanding it, they find meaning in it. I know children just jump at the chance to be incorporating it in their lives. I also think that before school starts, like thinking about those nuts, like you mentioned, that you can't always have at school, we
Yes.
can ease them in for the month of August and get that body resilience. So I love that. Thank you so much. There's
Oh,
so
you're so
much.
welcome.
Yeah, just it's just so fantastic to know that we're not going to just run into school and then feel like, gosh, we're here. Now my child's sick. We can
Yes,
start to do these little moments and getting that support. Wonderful.
absolutely.
So I could just keep talking to you forever. I'm learning so much. I know everybody listening is learning so much. And I guess share with us how do we learn more from your site, going on reading, what to get our children.
Yeah. So the
Yeah.
the best way to find me is on my blog site, my educational site. It's www.healthykidshappykids.com, and then also on Instagram or Facebook. And on Instagram, it's healthykids_happykids, and then on Facebook, you could just search Healthy Kids Happy Kids, and it'll show right up. So that's where I post lots of good information.
Mhm.
I blog posts, so you can find me there.
Wonderful. Any closing insights for those families out there?
I think that the biggest takeaway that I want parents to just have is that, we basically knowledge is power, right? That
Yeah.
once we arm ourselves with knowledge, we can move forward step by step to up leveling our kids' health, up leveling our health, and really getting to a place of thriving, not just kind of chasing our tails. So, we can do this, a team approach, right?
Yep.
We could do this with the whole child wellness approach.
Fantastic. Thank you so much for talking today, and I look forward to so many more opportunities. And thank you all for listening.